Hi, I'm Dr. Adith Venugopal and I'm a specialist orthodontist practicing at Pachem Dental Clinic in Cambodia in the city of Phnom Penh. I have an exclusive orthodontic practice here where I practice fixed, lingual, labial and aligner therapy. I'm also an assistant professor of orthodontics at a university called the University of Puthisastra in Phnom Penh. From the very early days, I was always fascinated towards the specialty of dentistry. As you know, dentistry is an art, and of course it improves the quality of life of a patient functionally, and at the same time it also improves the quality in terms of confidence, and that's actually what drew me towards this particular field. I have completed my undergraduate education from Rajiv Gandhi University of Health Sciences back in India, where I graduated with a BDS degree, after which I moved on to do my master's with a specialty in orthodontics in the beautiful country of the Philippines. So where I learned my orthodontics, it was an exclusive tweed practice, and that gave me the confidence to practice with edgewise later very comfortably. After that, I moved on to do my PhD from South Korea under the eminent Professor Hee Moon Kyung, who was actually one of the creators of the microimplant system, which we very commonly use these days. So I was lucky to work under him, learn from him, and also live in the beautiful country of South Korea, where actually I garnered my interest for research. I enjoy my orthodontic practice in Pachem Dental Clinic in Cambodia. I've had a variety of cases, and I'm so lucky to have treated so many different kinds of malocclusions and especially skeletal defects, along with complex dentofacial deformities. So it's been a lovely experience and a beautiful learning experience at the same time, which has given me a lot of confidence to treat patients of more severe complexity as well. Orthodontics is a passion of mine, and after I finished my specialty, I couldn't think of doing anything else but orthodontics. Of course, it has shaped my future in a tremendous way, in the way that I have now moved on to practice as well as perform a lot of research in this field. I want to give back to my specialty. We have seen quite a lot of expats coming in Cambodia, because you see, Southeast Asia is also very famous for dental tourism. And we have a lot of expats coming in from Australia and from neighboring countries like Thailand, China and India to get braces, to get a lot of dental treatment, implants and all those things over here. After I completed my PhD, I went into the research field as well, and I started writing a lot of scientific articles, and I started publishing a lot of my completed case reports. Now this is one way of giving back to the specialty, I feel. I would like to quote Lyle E. Johnston Jr. on this, and as he said that you must give back some of your time, talent and treasure back to your alma mater. And this, I think, is the best way you could do it, by giving back to your specialty in terms of publications, in terms of scientific research, and contributing to the field in a better way. I'm actually proud of a lot of pieces that we have written together, and I would like to thank my contributors, Dr. Jay Bowman and Dr. Nikhilesh Vaid, a lot. I'm very proud of one of the articles titled "The Quagmire of Collegiality versus Competitiveness," which is published in the American Journal of Ortho and Dentofacial Orthopaedics, and as well as some of my other papers on COVID research in the recent times. We feel that it's very apt at this particular point to mention that we as specialists or as professionals are not competitors, but we are colleagues, and we need to be collegial towards each other rather than develop or move ahead in a competitive spirit. I have been involved in lecturing throughout the world in, of course, the specialty of orthodontics, particularly speaking about TAD-based biomechanics. TAD as in temporary anchorage devices-based biomechanics to correct complex class 3 and class 2 malocclusions. I have also been appointed an associate professor, adjunct associate professor to Saveetha Dental College in India, and also have been appointed as a faculty emeritus of Nisargbai Dental College and Hospital in Gujarat, India. I love teaching and showcasing cases and showing the fraternity the mistakes so that everyone can learn from them and better the art and science of orthodontics. It's invaluable to me. And I think it's developed into a passion, and that's why I speak a lot at different organizations, conferences, and orthodontic webinars with the current situation. And I like showcasing my work as well as teaching in terms of iatrogenics in orthodontics, which is also one of my research passion. As you could see when you read my papers, you would see most of my case reports deal with iatrogenics, and I think it's very important to showcase someone's mistakes rather than just someone's success, because everybody likes to show their success in case reports. Very few people would actually want to show the mistakes and actually how you went about it in order to correct the mistakes. So I think that's again been one of my forte, in which I would like to speak more about. I'm very excited to share my experience with a global audience that LDI is catering for. And of course, the people from the West would learn of a very different kind of a treatment modality that is performed here in the East, and I'm sure it's like taking the pearls and using the best modality available for your patient's benefit. My subspecialty has been TAD-based biomechanics for class 3 and class 2 corrections of complex cases. So I would like to add in my experience with TAD-based biomechanics. So you would be seeing a lot of microimplants or temporary anchorage devices that have been used to correct different kinds of class 3, class 2 cases with bimaxillary protrusion, bidental protrusion, some severe anterior crossbites, missing teeth, molar protraction cases, and all those things. So I'm sure you're going to find it very useful to incorporate all these things in your daily clinical practice.